4, 3, 2, go.
This skill is designed to evaluate your ability to properly immobilize an uncomplicated shoulder injury. You are required to treat only the specific isolated injury to the shoulder. The scene survey and primary survey have been completed and a suspected injury to the right shoulder is discovered during the secondary survey.
Okay.
Continued assessment of the patient's airway, breathing, and central circulation is not necessary. You may use any equipment available in the room. You have 5 minutes to complete this skill. Do you have any questions?
Nope.
Whenever you're ready, go ahead and begin.
Okay, I got my BSI. I'd like to direct my assistant to manually stabilize the patient's shoulder. She's pretty much doing a good job of that herself. I'm going to use triangular bandages and form them into a sling and swath. I'm also going to make sure I check the distal CMS before I do anything else. So, excuse me, just going to reach here. Does she have a good, strong radial pulse?
Yes, she does.
Okay, can you squeeze my hand? Good, you can feel me touching? Okay, any numbness or tingling in your fingers? Okay, good. Alright, so this is going to be around the elbow. I'm just going to slide this under your arm, nice and gently. Go. Point my elbow. Now I want to make sure that I immobilize the elbow. I'm also going to place this so that it's supporting her wrist. She's a relatively small patient, so we're going to have plenty of extra room here. If you don't mind, I'm just going to kind of let this, kind of gradually let me take the weight of her arm in the sling here. Make sure I've got plenty of room at the elbow. There we go. Nice and gentle. Alright. Now what some people do is they'll tie a knot here first. I personally prefer not to, but that's just a personal preference. And we are going to tie a knot back here, and I'm going to use some of what I have here as padding for this knot. Does it feel like this sling is adequately supporting her arm, or do we need to draw it up some more? Okay. Alright. We're not going to place the knot over the spine, but onto the shoulder. Still feels like it's supporting adequately?
Yep.
Okay, I'm going to take this excess material I have here, and I'm going to twist it so I get a good nice pocket there. Now, if you don't mind, just holding that right against her arm, I'm going to tape it in place. Like I said, some people will just tie that in a knot. That's perfectly acceptable as well. But this is the way that I find to be easier. Okay, so that's a sling. I've immobilized the elbow joint. It can't move anymore. I've immobilized the wrist, actually. Now I'm going to go ahead and apply a swath to immobilize the shoulder and keep it from being able to move this direction. Okay, so this is going to go around here underneath your wrists. I'm going to tie another knot here, and likewise I'm going to use some padding that I have. This knot from being too uncomfortable on you on your way in to the inverted suit. Does that feel okay? Feels like your arm is well supported?
Yes.
Okay. Okay, good. So it looks like I've adequately immobilized the shoulder and the elbow and the wrist. I'm going to recheck distal CMS. Do you still have a good strong pulse there?
Yep.
And you can still squeeze my hand. Okay, feels the same strength as before. You can feel me touching. Any numbness or tingling in your fingers? Okay, I'm done with the skill station.